When dealing with mechanical hip pain, one of the primary objectives is to ensure there is adequate joint mobility. Now remember, the purpose of any synovial joint is to allow motion between two adjacent bones, and this is particularly important for the hip. Now we've of course talked about the importance of hip mobility and flexibility in the past. In recent videos, I've even gone over our basic movement sequence, and I'll put a link to these videos in the description below. But for anyone who is not familiar with these routines, they are essentially focused movement sequences that encompass all the basic fundamental movement patterns of the hip. It's really these routines that are going to form the foundation of our treatment approach to mechanical hip pain. Now, the basic concept here is that we're just trying to get the hip moving properly again. Remember, a hip that works right will hurt less and be able to do more hip things. But if the hip can't tolerate basic motions or can't move in all the directions through which a hip is supposed to move, it's going to have a lot of trouble doing even basic things like walking or running or climbing stairs. So like I said, these routines form a critical part of care, and they make up the backbone of our home exercise prescription. And in many cases, these movement routines, in combination with our manual therapy, will be all that is needed to get the hip moving and feeling better and working the way it's supposed to. But there is a limit to how much these routines will improve flexibility on their own. And so there will be times when we need to add some more focused stretches to more aggressively target any of these range of motion deficits. Now, I like to refer to these as flexibility or mobility breakouts. Think of these breakouts as a more focused targeting of specific flexibility deficits. But instead of thinking these in terms of muscles we're trying to target or stretch, we want to think of these in terms of joint motion. So for example, we're going to create stretching or mobility protocols that target abduction or adduction or rotation as opposed to any specific muscles. So what I'm going to do here in this video is review the mobility breakouts that I use when I'm trying to target and improve hip internal rotation. First, I'm going to review the stretches and exercises themselves. Then to finish up in the video, I'll talk about programming variables. The three exercises we're going to review are the band-assisted quadruped hip internal rotation mobilization, the 90-90 hip internal rotation stretch, and the 90-90 hip internal rotation contract relax stretch, or hip IR PAILs. Now remember, as always, if you are a My Rehab Connection subscriber and you use our exercise prescription software, you can find all of these exercises in the exercise library. You can either search for them by name in the exercise library itself, or you can find them in the exercise group section under the title Hip Internal Rotation Mobility Breakouts. Now, let's review the exercises. All right, so this is going to be the quadruped band-assisted hip internal rotation mobilization. Now, I really like this because it's very, very similar to one of our basic exercises that we're going to include in our just our basic hip mobility sequence. So the patient and client will be familiar with this, which gives them context. They're not having to learn an entirely new movement. But what we're going to do here is we're going to add a band so that the motion can be increased beyond what they can do themselves just from an active range of motion position. So what I'm going to do here is I'm going to use my stretch band, and I'm going to get it simply secured beside me. I'm going to get this put around my foot or my ankle, and then I'm going to just simply get in my basic quadruped position. Now from here, I'm going to take my leg, and I'm going to rotate inwards. This is hip external rotation. It helps get some stimulus onto those muscles. I'm going to hold for just 1 to 2 seconds, and then I'm going to rotate my hip outwards. And in this outwards position, this is producing internal rotation of your hip. But what's happening here is the band is assisting me. The band is pulling my hip farther than what I can do on my own. But keep in mind here, this isn't just the band, it's band assisted, which means I'm also using my muscles to help generate that internal rotation motion and internal rotation torque, but the band is assisting to get a few more degrees than I can get on my own. And what I'm typically going to do here is nice and slow inwards. Again, don't worry about how far in the band is going, or excuse me, how far in the motion is. The band is really biased towards creating that internal rotation torque. So we're going to go inwards just a little bit, hold for a moment, slowly rotate outwards, really let that band pull, but really try to get your hip doing the work, internally rotating from the hip joint itself. Hold 1 to 2 seconds, and I'm going to slowly perform this back and forth motion 8 to 10 times, really trying to focus that emotion at the hip itself. All right, so let's review the 90-90 hip internal rotation stretch. So what we're going to do here is we're going to get into our basic, what we call our 90-90 position. The idea here is the back knee and front knee are bent 90 degrees and our thighs form an approximate 90-degree angle. And we're going to just kind of try to get our body somewhat upright, but remember it should be comfortable. And then we're going to rotate back towards the back leg. And this is the leg we're trying to target. So the idea here is we're trying to create internal rotation at the hip, but the hip is kind of stationary. So as we rotate back, we're creating this rotation of our pelvis, which is creating the motion at the joint. And what we're going to do is we're just going to simply rotate back until we start to feel some pull or stretch in and around the back and along the side of our hip. Now, when we're doing this, I think of this when I'm explaining this to people as our base position, but we also don't want to discount the valuable information that our patient's body is telling them. So from this position, oftentimes people might have to kind of move around or explore in order to get the appropriate stretch. That may include being a little bit taller or less tall with the trunk, playing around with hand position, or even playing around with leaning back, or how far or how they're twisting towards that back leg. Now, once we do feel the stretch, as our goal is we're trying to increase focused mobility, a typical prescription with this is we're going to perform 3 repetitions of 30-second holds. Now, with that being said, in some instances, we may even want to create a longer hold just to get a different type of tissue adaptation in and around the hip. So another option would be we can also have them hold that final stretch for longer, even up for a couple of minutes. Now, just before moving on from this exercise, I should just make a point is when we are doing, whether it's even the 30-second hold, or especially when we're doing some of these longer 2+ minute holds, this doesn't mean we have to stretch and not move. Within that time, as the clock continues to tick, we are certainly more than able to wiggle around. So we might kind of be rotated back, and then if we have to take some pressure off, lean back, so we can explore within that time frame. It's just that we don't want to completely come out of this position, because when we do, that's when the clock is going to stop. So another option, or even another progression that we can piggyback from the basic hip 90-90 internal rotation stretch, is we can add some contraction or a contract-relax component to the stretch. This is often referred to as a PAILS, or a progressive angular isometric loading exercise, which has really been made popular and is a key part of some of the FRC, or functional range conditioning system. If you're not familiar with them, they've got some really great stuff, and you can check them out online as well. But what I'm going to do here is we're going to, again, adopt this basic 90-90 position, just like we did in the previous exercise. I'm going to rotate back towards that back leg to create that internal rotation stretch in that back hip. But now, instead of simply holding the static stretch, I'm going to add some contraction. So in this case, I'm going to take my back leg, my back foot and ankle, and I'm going to start to build up some pressure. I'm going to push this down into the floor. This creates some contraction of the rotational muscles around the hip. So I'm going to build up my contraction. Now the sensation of stretch around the hip is essentially replaced with the sensation of the muscles creating a gentle contraction. I'm going to hold this pressure and this contraction down for 8 to 10 seconds. At the end of that time, I'm going to slowly let the muscles relax. And again, I'm going to give it a moment or two to let the muscles settle. From here, what we'll often find is we have reduced that sensation of stretch in the hip, and then we can rotate back a little farther, and this will help to take up the slack in the joint. And so here we're using contraction to create some stimulus from this stretched position to try to open up the joint a little bit farther. Now, a typical prescription here would be I might repeat this contract, relax, and then stretch cycle 3 to 4 times. And as long as the hip is still tolerated, it can be really effective to hold that nice long static stretch at the end of those contract, relax cycles to really help create more of that stimulus and open up that hip into that IR direction. All right, now let's talk about programming. Now, to put this into context, remember one of our key goals when treating mechanical hip pain is to improve the mobility and control of the hip joint itself, which, as I stated earlier, is the focus of our hip mobility movement sequence. Now, we can really think of these flexibility breakouts as working towards improving the patient or client's ability to perform this movement sequence. So when prescribing and programming these exercises, I like to pair the breakouts with the mobility sequence itself to essentially create a focused hip movement routine. Now, for example, I will have the patient or client start by performing the band-assisted quadruped rotation exercise, followed by a 90-90 hip internal rotation stretch or IR PALS exercise. And what I will have them do is repeat this sequence 3 times. Then following this, I will have them perform the full hip movement sequence. Here it's almost like we're trying to increase the rotational mobility of the hip with the breakouts. Then we're teaching the brain how to use and access this mobility when using the hip itself. Now, just as a quick side note, while I'll keep this video focused on the IR breakouts, I will just mention that if there are other range of motion deficits that I'm trying to target, I will also include them here. So for example, in addition to the internal rotation breakouts, I also may program hip extension or hip external rotation exercises. I'll go over the specifics of these exercises in other videos. I just wanted to point this out here so you can see how to program these movements together. Now, lastly, as I mentioned, I do like to pair the focused mobility breakouts with the basic mobility sequence. But how I will typically do this over the course of the week is I will have patients perform the basic hip movement sequence twice a day. And with one of those sessions, they will also complete the focused hip mobility breakout. Now, I have found this works better for most people because what they're essentially doing is they're getting regular movement stimulus to the affected hip. But as this focused hip rotation breakout can create more stress, they often can't be tolerated as frequently. So this will, of course, depend on the patient. In some cases, I may even have the patient perform the focused mobility breakouts only 3 times a week just to make sure there's a recovery day in between.